What we are living through is a horrific national tragedy. Families have lost loved ones, um, been devastated by these tragedies, and we need to know that there are more tragedies to come.
A tragic landmark. More than 10,000 Canadians have lost their lives due to COVID-19. 10,000 people. That's since the first death took place on March 8th at the Lynn Valley Long-Term Care Home in North Vancouver. But here's some new information. People of color in Canada are dying in far greater numbers than anyone imagined, according to a new report released by the Public Health Agency of Canada. So why are some groups more vulnerable to the disease than others? To find out, I sat down with Canada's Chief Public Health Officer, Dr. Theresa Tam, earlier this week. Always good to see you, Doctor. I hope you and your loved ones are doing well. Dr. Tam, 10,000 deaths. 80% of them were elderly people. Most of them, of course, were in the long-term care home facilities. Now that we're in the second wave, considering all the precautions that we've taken, including in long-term care homes, do you expect the second wave to have the same number of deaths as the first wave, or do you think the mortality rates will go down?
Well, it's difficult to say. Again, everything depends on what we do. I sincerely hope that we're not going to repeat the tragedy that we have in the first wave as it pertains to long-term care facilities. What I would say is right now, for a large number of the cases are still in the younger adults, but as we've seen in certain areas of the country, it's beginning to impact older age groups. And it's difficult to shut out this virus from entering the older age population. It's really difficult to do.
Let's talk about high-risk populations. You wrote in a report in the past week that people of color are more likely to contract COVID-19, Middle Eastern, Black, Arab, Latin American, South American, Southeast Asian Canadians. More than 80% of the cases in a city like Toronto, they're barely 50% of the population. Is this an example, and you talk about economic inequities, is this an example of what some have called systemic discrimination, or is it inequities? Why are those folks being so impacted?
Well, I think there's different components as to why different groups experiencing systemic inequities have been highly impacted. One is that they are often doing our essential services. So they can't stay at home, and therefore there's increased interactions with the general public or with patients if you're in healthcare, in agricultural sectors trying to put food on our tables. So they're essential workers who have to take public transport, carpool, and therefore at a higher risk than the rest for being exposed. They are in low wage, precarious job situations, where some have to hold down more than one job and therefore could potentially inadvertently spread amongst their own community or in their different long-term care facilities, for example. They may be living in more crowded conditions because they have poorer housing supports. So what we mean by some of these structural or social determinants of health include housing, include income, include education and other factors where people just haven't had this similar access also to services, health services and other services, thereby leaving them at higher risk of contracting COVID-19 overall.
Earlier last week, the CEO of the Business Council of Canada, Goldie Hyder, wrote a letter to the Prime Minister and the Finance Minister, and I'm going to quote what he said. He said, "Canadians have grown increasingly frustrated by confusing and contradictory public health advice, causing some to lose faith in the system's ability to protect them. This cannot be left unaddressed." Dr. Tam, do you agree that the message has been confusing and contradictory, and that has led to mistrust?
Well, in this stage in the pandemic, we are experiencing different disease activity in different areas of the country. What public health has tried to do, and listening to different sectors as well, is that we need to have a balance between restricting and restrictive public health measures and opening up society. So public health is trying to get that balance so that we can have kids going back to school, we can have people going back to work without the virus transmission escalating out of control.
Okay, let me just talk about testing and tracing. You have said we need to test, trace, and isolate, but testing numbers are down. Contract tracers have been overwhelmed. Sometimes we rely on the honor system for people to isolate because it's difficult to check up. Do governments and public health officials need to take more dramatic measures to curb the spread? France is going into another national lockdown. Do we need to do that?
So at the beginning of the first wave, each individual case only had a few contacts because we had much stricter public health measures. Now, if people don't help, public health is never going to keep up. It's not an infinite capacity. So yes, we do have to escalate testing. So you've seen more tests, testing capacity come online, more point of care testing, for example, and more of these tests are being licensed, approved by Health Canada, and the federal government's putting in resources, putting in financial support. So those things are increasing capacity. I can't speak to why the numbers are necessary down at this time, probably because of some of the human resource capacity at the local level.
But to be fair, Dr. Tam, people have done an incredible job for 9 months. There is legitimate COVID fatigue. The Prime Minister has already said Christmas is in jeopardy. I'd love your view if you think Christmas is in jeopardy for visiting families. You know, what do you say to people who just are, I understand you're saying you got to keep listening. They're not. They're breaking bubbles. It's changing. That's why we're in the second wave. Something's got to change in the message, because if the message doesn't change, you're going to get less compliance. What do you think needs to change right now?
This is a road that we must travel. This is a path that we have to keep going on, and we need that second wind. Now, how do we do that? Is actually, one, make it a sustainable thing. As I said, it's got to be like daily habits such as brushing your teeth when you think about putting on a mask. We've also got to have more innovation in how to make these social interactions safer. We've put down some sort of ground advice and guidance.
Just be practical. People are asking. They just want to straight it, like, you're the chief public health officer. Do you think people should be able to go to a different city and visit their family for the holidays?
So every individual has a different risk assessment. So one is, what is the look at what the local activity is like. Assess your own risk. So if you are someone with an underlying medical condition or you're elderly, there are different choices that you're going to have to make. 3 is to keep your family safe, keep the numbers low. I think this Christmas is not going to be the same as Christmas 2019. This is a different kind of Christmas. And reducing the number of contacts is very, very important.